Are you feeling different and wondering if you might be pregnant? In this video, we are going to talk about the early symptoms of pregnancy, how to recognize them, and the right time to do a pregnancy test. If that sounds like what you're interested in, then let's dive in. Before we talk about the symptoms, let's talk about what happens in the body during this time. When the sperm gets to meet the egg, the sperm from the man gets to meet the eggs in the fallopian tubes of the woman. Fertilization occurs. The fertilized egg, now known as embryo, travels down into the uterus, where it gets implanted. This is pregnancy. At the point of implantation or after fertilization, the hormones human chorionic gonadotrophin, which is the hormone we test when we do pregnancy tests, begins to be released into the blood. So this gives rise to the symptoms you feel during pregnancy. So what are these symptoms? The first symptom, if you're a woman with regular menstrual cycle, the first symptom you will notice is that you have missed your period. When you have missed your period, it's likely you're pregnant. Another symptom is you start feeling fatigue. You start feeling unusually weak and sleepy. This is due to the effects of human chorionic gonadotrophin, which we call HCG. You start feeling nauseated. You start feeling like throwing up, especially in the morning, and that is why it's called morning sickness. This feeling nauseated doesn't only happen in the mornings. It can happen any time of the day. And in most people, it usually sets in from the 4th to the 6th week. It can also come up earlier. So if you've missed your period, you're feeling weak, sleepy, nauseated, or even vomiting, suspect pregnancy. You can also start feeling fuller in your breasts. Your nipples will become more sensitive and tender, a little bit painful. You start craving for things you don't used to like before, and you start hating some of the things you even like. This is called mood swings and cravings. Your mood become irritable. Little things irritate you. You are no longer the same. The hormones in your body are playing tricks on you. You will also notice that you start passing urine more often because the blood flow to your kidneys are increased. Those are the common early symptoms you notice that will give you a hint that you might be pregnant. Now, if you are somebody with irregular cycle, missing your period might not be a point until you start feeling funny, you start having all these symptoms. Then go for pregnancy test. You can also buy pregnancy strips off the pharmacies. When you dip the strip into your first urine in the morning, if you see 2 lines, it's positive. It means you're pregnant. If you see 1 line, or you see a line and another faint line, what you do is you wait, especially if you're having these symptoms, you wait for another week and repeat the test. By this time, the HCG hormones could have built up more, and then it can give you a positive result. You could see 2 lines on the strip. That confirms your pregnancy. If you still don't see 2 lines and you're having these symptoms, or you see a line and another faint line, then it's time for you to go to the hospital to get properly tested. They will use blood to test for pregnancy test, to do the pregnancy test. And if it still comes out negative, that is 1 line, then you need to do more. You need to go for more investigation to find out what is wrong. So the best time for you to do your pregnancy test is 6 weeks of your missed period. That means 2 weeks after your missed period. And you go to the hospital to confirm. If it is confirmed that you're pregnant, then it is time to discuss antenatal care. It's time for you to register for antenatal care and get proper attention. Wishing you all the best in your pregnancy journey.